This is an urgent national update for all Australian seniors aged 67 and older. From the 5th of December, major driving rule changes are coming into force across every state and territory. These reforms have been quietly discussed by transport departments for months, but now they are finally being activated, and they will directly affect the ability of older Australians to drive, renew licenses, and stay insured. Whether you live in New South Wales, Victoria, Queensland, Western Australia, South Australia, Tasmania, the Northern Territory, or the ACT, these new rules will reshape how seniors stay mobile, safe, and legally protected on the road. Let's start with the direct update first. The 5th of December marks the first coordinated national adjustment to senior driver regulations in over a decade. The Council of Australian Government's Transport and Infrastructure Committee has approved a framework that standardises age-based assessments, licence renewal frequency, and medical reporting requirements for senior motorists. This means that from December, all jurisdictions will align on tighter safety protocols, mandatory health checks, and clearer insurance disclosures for anyone aged 67 and above who holds a full or restricted licence. It's been described as a mobility and safety reset for an ageing population, one that balances independence with public safety. The new system introduces what officials call an active fitness to drive framework. This requires older drivers to provide more regular medical certification, complete visual and cognitive assessments, and in some regions, pass practical driving reviews. For example, New South Wales will begin annual health checks at age 75, but drivers aged 67 and above must now confirm their medical status upon licence renewal. Victoria will introduce a new self-assessment and doctor confirmation system, while Queensland will require updated medical fitness reports every 3 years after age 67. This harmonisation ends the patchwork of rules that previously left older Australians confused and vulnerable to inconsistencies between states. The immediate reason for these changes is the rise in serious accidents involving senior drivers. According to national road safety data, drivers over 65 are involved in a growing percentage of fatal and near-fatal crashes, especially on rural and regional roads. Authorities emphasize that this is not about punishment, but prevention. The goal is to ensure that people who wish to continue driving can do so safely and responsibly. Officials have stated that mobility and independence remain key values, but so does protecting lives. In New South Wales, older drivers will now need to provide a medical certificate from their general practitioner confirming that they are fit to drive. This certificate must cover vision, motor control, cognitive ability, and reaction time. If any doctor expresses concern, the driver will be referred for a formal on-road driving test conducted by Service NSW. Previously, this on-road assessment was required only from the age of 85, but beginning December, drivers aged 67 and older can be asked to take this test if flagged by their medical practitioner. The aim is to catch early warning signs of declining ability before accidents happen. Victoria's Department of Transport has confirmed that similar reforms are rolling out under what it calls the Safe Senior Mobility Plan. It will no longer be enough to simply renew a licence online. Every Victorian over 67 must now submit a short medical self-declaration and have their doctor confirm it electronically. Drivers who have specific medical conditions, such as diabetes, stroke history, or cognitive impairment, will automatically receive conditional licenses that may include restrictions such as daylight-only driving or limited kilometre zones. These measures are designed to reduce accidents during night hours or in complex traffic conditions where slower reaction times can lead to serious collisions. Queensland, which already required medical certification from 75, is moving to a tiered system. Beginning on December 5th, drivers between 67 and 74 will be required to declare their medical status when renewing a licence. If the declaration indicates any health issue that could impair driving, the Department of Transport and Main Roads will issue a Fitness to Drive request. This triggers a medical evaluation process similar to that in other states. Officials say the goal is consistency. Seniors should not face completely different standards just because they cross a state border. Western Australia and South Australia are also introducing aligned systems. In WA, the Department of Transport will now send automated reminders to drivers approaching 67, advising them of the new obligations. After that age, every licence renewal will include a short medical confirmation. South Australia will apply the same rule, and its Minister for Infrastructure and Transport has stated that these adjustments are about empowering seniors to stay safe behind the wheel, not pushing them off the road. That reassurance is important, as many Australians depend on driving to attend medical appointments, visit family, or shop for groceries. Tasmania, the ACT, and the Northern Territory are also joining the harmonisation process. All three territories will require a medical report from age 67 onwards, with renewal periods shortened to 2 or 3 years depending on local circumstances. For remote or rural drivers, telehealth assessments may be allowed. The Commonwealth Government is working with state authorities to ensure no senior loses their licence unfairly due to location or mobility limitations. Behind these reforms lies a strong emphasis on insurance and liability protection. From December, car insurance providers will have the legal right to request proof of medical fitness to drive for any senior claimant aged 67 and older. This means that if an accident occurs and the driver cannot show recent medical clearance, insurance coverage could be delayed or reduced. Experts say this is one of the most important aspects for seniors to understand. The medical certificate is no longer optional paperwork. It is now a critical document for financial protection. Without it, a single accident could result in costly out-of-pocket expenses. The insurance industry has been calling for these reforms for several years. Claims data shows that health-related impairments, such as slower reflexes, vision decline, or medication side effects, have contributed to an increasing number of at-fault accidents among older drivers. These new rules are intended to reduce that risk and make sure both drivers and insurers are on the same page. From a financial standpoint, it's also expected to reduce premiums for seniors who remain medically fit, as insurers can price policies more accurately once risk assessments are standardized nationwide. Another major change involves how license renewals will be handled online. Previously, most states allowed automatic renewal for eligible drivers, often with minimal verification. Now, from the 5th of December, the new system will include integrated checks across MyGov and state transport systems to confirm that health certifications are current. This digital verification ensures that only medically cleared individuals can renew. For seniors who are not comfortable with digital services, manual renewals at service centres will remain available, but staff will be required to verify the same documents. The shift is part of a broader, Safe Mobility for Seniors 2030 agenda led by the federal government. The agenda recognises that by 2030, nearly 1 in 4 Australian drivers will be over 65. This demographic change means that road safety policies must evolve to reflect the realities of an older population. Governments are investing heavily in programs that support seniors to continue driving safely for as long as possible. This includes funding for free or discounted driving refresher courses, mobility aid programs, and public transport concessions for those who choose to retire from driving voluntarily. The 5th of December rollout is being described by transport ministers as the first step toward smart licensing for seniors. The term refers to a new model that connects medical assessments, license renewals, and insurance systems in real time. For example, if a senior driver submits a doctor's certificate, it will automatically update their license profile, ensuring compliance across all government platforms. This prevents accidental lapses or mismatched records that could invalidate a license. It also helps emergency services identify if a driver has a medical alert, such as diabetes or a heart condition, which can be vital in a crash response. public reaction has been mixed. Some seniors welcome the changes, saying it gives them peace of mind knowing that they are driving legally and safely. Others fear it's the beginning of more restrictive measures that could eventually limit older Australians' independence. Authorities have tried to reassure the public that these reforms are not about discrimination by age, but about practical safety standards. The government's message is clear: people age differently, and the goal is not to set an arbitrary limit, but to ensure that each driver is genuinely fit to drive. Health professionals are also being given new responsibilities. General practitioners will now have to complete a standardized fitness to drive certificate that rates patients on specific categories, including visual acuity, reaction time, coordination, and medication side effects. The forms will be electronic, linked directly to transport authorities, and will replace the patchwork of paper forms used previously. Doctors who suspect that a patient is no longer safe to drive will have a legal obligation to report this to authorities. At the same time, confidentiality rules will ensure that patient privacy is respected unless there is a clear safety concern. For seniors, this may sound intimidating, but the government emphasizes that the process is designed to be fair and supportive. Drivers who temporarily fail a medical assessment due to short-term issues, such as surgery recovery or medication changes, can apply for temporary suspensions instead of full cancellations. This allows them to return to the road once they regain fitness. Transport departments are also required to provide written guidance explaining every decision, giving seniors the right to appeal if they believe a ruling is unfair. The timing of these reforms, just before the Christmas holiday travel season, is deliberate. Authorities want to make sure that older drivers are medically cleared and aware of the new rules before the busiest road period of the year. December and January are traditionally high-risk months for accidents, and with many seniors planning long-distance trips to visit family, officials say it's better to implement the changes now than wait until after the holiday rush. There is also a technological component being added to assist with compliance. Several states are introducing optional smart license cards that can store medical clearance data electronically. These cards will work like regular driver's licenses, but include a chip that verifies whether the holder's medical certificate is current. When police or service agents scan the card, they can immediately see whether the driver is cleared to operate a vehicle. It's a small innovation, but one that could make a big difference for enforcement and convenience. In rural areas, where access to medical services can be limited, special arrangements will be in place. Telehealth consultations will be recognized for medical assessments, and mobile testing clinics will visit regional towns to conduct driving evaluations. Authorities acknowledge that rural Australians depend heavily on their vehicles, often having no alternative transport options. For them, the reforms aim to make compliance as easy as possible while maintaining safety. The federal government is also funding a communication campaign to ensure that no senior misses this information. Television, radio, and print advertisements will run throughout December, explaining what seniors need to do. Letters are also being mailed to households with drivers over 67, outlining the new obligations and reminding them to book medical appointments early. These changes also intersect with Centrelink and pension eligibility rules in subtle but important ways. While the new driving regulations do not directly affect pension payments, seniors should be aware that mobility and health assessments are often linked in government databases. Keeping your driving medical certificate up to date may help prevent inconsistencies when applying for related benefits or rebates that depend on verified identity and health information. Officials stress that the reforms are designed to modernize records, not complicate them, but it's another reason for seniors to act promptly and stay organized. For many older Australians, driving is more than just transportation. It's freedom, independence, and dignity. That's why these changes matter so much. The goal is not to restrict, but to preserve that freedom safely. Authorities understand that telling someone to stop driving can be emotionally difficult, and these rules are intended to make that conversation fair, respectful, and evidence-based. A doctor's decision will now rely on standard national guidelines rather than personal opinion, ensuring that every senior is judged by the same criteria no matter where they live. As part of the December reforms, Governments will also expand funding for alternative mobility programs. Seniors who voluntarily surrender their licenses can access special travel vouchers, taxi subsidies, or free public transport cards. These benefits are designed to soften the impact for those who decide to stop driving. In many states, the savings can amount to hundreds of dollars a year. Officials hope this incentive will encourage honest self-assessment and responsible decision-making among older drivers. The update taking effect on December 5th will also impact vehicle registration policies. In some jurisdictions, vehicles registered to senior drivers may receive renewal notices that include reminders to update medical information. This ensures that vehicle ownership and driving authority stay consistent. The broader digital integration between transport, health, and insurance databases is expected to reduce fraud and administrative delays. Overall, these new measures represent one of the most comprehensive reforms in Australian transport policy in years. They align with similar steps being taken internationally, such as in Canada and the United Kingdom, where governments are also modernising senior driving frameworks to reflect longer lifespans and shifting demographics. The message is clear: the right to drive comes with responsibilities that evolve with age, and these reforms are meant to make that evolution transparent and fair. As the 5th of December approaches, the most important step for every senior driver is simple: check your license expiry date, book your medical appointment, and make sure your information is current. Doing this early will prevent complications later. From that date onward, all renewals, replacements, or medical declarations will fall under the new framework. Seniors who delay could face renewal refusals, insurance issues, or even temporary suspensions until documentation is complete. Authorities are urging everyone to act now, not after the deadline. Part 1 ends here with the complete overview.